Hello and welcome to this episode of Akrinos Access. I'm your host, Eric Matei, joined today by Ali Oromchian for a deep dive into the world of human resources. And we're calling it HR and Your Modern Practice. Many of you probably know Ali. He is the co-founder of HR for Health, which we'll get into talking a little bit about here later in this episode. But Ali, man, thank you so much for joining us on this episode of Access.
Yeah, my pleasure, Eric. Thanks for inviting me, and always fun to be here. I'm a little bit sad, I'll be honest, because my Niners lost yesterday, but in thrilling fashion. But otherwise, it's a good Monday.
Fantastic. Well, Ali, let's go ahead and kick off this conversation let's just start by defining human resources.
Yeah. Well, human resources is really a catch-all for everything that has to do with your employees in your practice. And when I say everything, I mean everything from the legal side, which is sort of the bulk of it, but also team management, team building, that's a huge component. And then, of course, the relationship between your team and the patients, which is also important. We sort of bundle all that up into really what's called human resources. So,
sure, yeah. So when we're looking at this, then there is, I know there's a lot of questions out there regarding the legal aspects of HR, and then the other kind of best practices aspects of HR, which maybe aren't legal requirements,
yeah.
But I mean, let's face it, in the modern business environment, there are certain things that we'll want to be sure we're ensuring for our team. So why don't we maybe start to unpack some of that and start talking about the impact of human resources across different facets of the practice?
Yeah, absolutely. Yeah. So what happens, Eric, with HR when you're thinking about it from a entrepreneurial perspective, it's one of those amorphous things that you need, right? Because you're going to hire team members, whether it's like one or two when you initially start, or if you're taking over someone's practice, you're going to have a whole bunch of them that you're bringing on. It's something that people know they need to know. They know it's very important to know. But the question is, how do you go about becoming knowledgeable about it? How do you become compliant with it? Because there's so many different rules that you have to abide by. And since COVID, it's been even crazier because we used to have only state rules that would change every year really on these kind of topics. But now the federal government is coming in and adding all these extra restrictions and rules, which sometimes complicates things because you got to balance the state rule with the federal rule, right?
Sure.
So it's becoming a lot to juggle, right? It's becoming a lot to juggle. And when I see our doctors get in trouble in their practices, Eric, it's not because they're intentionally trying to do bad things to their employees, right? I mean, that's not how doctors think, right? They're there to help their patients, and they're not natural born entrepreneurs for the most part. It's a skill that they learn, with help and education and people like you who hold their hands through the process. And so they get really hurt, both psychologically and emotionally, when an employee comes after them for these tic-tac violations, because they know they are trying really hard. They just can't get it to 100% without help. And that's really where HR for Health comes in. But that's the psychology, right?
Yeah. And as you're touching on that, Ali, I think this also brings to light kind of a bigger theme through all of this, which is that, look, I mean, the modern business environment is complicated. There's a lot of moving parts. And I think now more than ever, for entrepreneurs to be proactive in seeking out the solutions to be sure it's done right. I mean, that's really fascinating what you guys have done with HR for Health and providing this solution. But before we jump into that, I'd like you to share, speaking of some of these things that are getting doctors in trouble. I know, Ali, you and I, we've we work very closely between Akrinos and HR for Health and your law firm, Dental Medical Counsel. And you share with me on more than one occasion that doctors are more exposed from an HR violation than they are from, say, a malpractice claim. Why don't you elaborate on that, Ali? And then maybe also share some of the most common things you guys are seeing that doctors are maybe not being attuned to that's leaving them exposed.
Yeah, absolutely. Yeah, I'm glad you remember that, Eric, because it's true. Most of the doctors that are coming out right now or have been out, let's say the last 10 years or so, are extremely well trained, right? Are extremely well trained. And so they have so many opportunities, for mentorships and the schools and technology, that they're coming out better than really any optometrist has ever been able to come out, because they have so many tools at their disposal that I think the older generation, optometrists wish they had, right, coming out.
Sure.
And so you know the malpractice side is really being outpaced by these HR violations, because what hasn't changed really is the complexity of these HR items are becoming more complex. And what hasn't changed is that there has never been a tool to help people get compliant until HR for Health. And so as a result, people were getting, hung up on these common violations. And now you asked, what are the most common? Well, the number one by far, like hands down, is something called wage and hour. Okay. It's the most common because it has to do with how the employees are being paid. Okay. Now
Okay.
you might say, or the doctors that are listening today be like, I don't understand how could I make a mistake on that? They work this many hours. I pay them this much money per hour. Like I just multiply, right? And I give it to payroll, and then they run it. But it's not that easy, of course, right? It's not that easy, because wage and hour encompasses lunch, right? Are you giving lunch to your teams at the right time? Are you giving them enough of a lunch, right? Is it in your employment manual when they take their lunch? Breaks, right? Many states, you have to give a break to your employees. Are you giving that break? Is it documented in an employment manual, or do the employees not get a break? And then things like compensation, although it sounds easy, it gets complicated because a lot of offices, as you know, give bonuses, right? Discretionary
Sure.
bonuses. And I'll give you this example. A discretionary bonus in, basically almost everywhere in the country, if you're giving a discretionary bonus to someone, you don't need to add that compensation back to, or divided by their hours work and add it back to their hourly wage. If it's discretionary, meaning you give it if you want to, you don't have to give it if you don't want to. If it's not non-discretionary, meaning the employee knows how many hours they have to do, when they do it, how they get paid, then that dollar amount on the bonus needs to be added back to their hourly wage. So let's say, for example, they were making $20 an hour, okay, and they got $1,000 bonus, right, for the year. Well, and let's just say, just to make the math kind of easy, right? Let's say they did, they worked 2,000 hours, okay? So they got $1,000, right? And then they worked 2,000 hours, and their hourly rate. You got to do the math so that you can figure out that hourly rate wasn't really $20. It was really more than that because of the bonus.
Because of the bonus. Sure.
Because of the bonus, right? Because it's non-discretionary. Now, it might go up to, $20.50, right? Or some other number. That impacts overtime and other things. And so again, it's a very fine point that's really hard for doctors to sort of grapple with. But
absolutely,
but it's one
in
of
the weeds, man.
So yeah.
And that, I mean, Ali, I think, and I was capturing some notes here, kind of following this along. That's just one example of a big, massive world of a bunch of employment guidelines that, to your point, not only on a state level, but now in a post-COVID era,
Right.
Also some more federal guidelines that are being pushed out. So let's maybe talk about this and maybe share some of these key areas of human resources, particularly, the importance of employee handbooks and code of conduct and kind of some of these structural areas. Ali, we talk a lot with doctors, and certainly in the solutions we provide, a lot of it is around the structural components of the business, right? So where we're focusing on financial pro forma and market analysis and strategic plan, what are some of these structural elements of human resources that doctors should absolutely, whether they're updated or not, just absolutely have these things in order? And then we'll get to some updating here shortly.
Right.
What are some of the structural areas?
It's a great question. It's a great question. And I would say there's a bunch of them, but the top three, are these. And I'm going to go from basically the beginning of someone's employment to the end. Okay. Just to make it
fantastic,
make sense. So the first thing structurally is you need to have all the new hire documents for all the employees. Now, those can be anywhere from 12 to 26 or 7 documents these days. Okay. Depending on what state you're in, right? Depending on what state.
Okay.
Yeah. It's very state specific. Now, what happens, Eric, the problem with this first part is that people go to like their payroll company, right? They don't, and the payroll company says, we do HR compliance. They don't, right? They run payroll. Their version of HR compliance is that they give you the federal documents, maybe an employment manual too, a generic employment manual, but they give them the federal documents. They don't give them all the other documents they need for their optometry practice, because the payroll companies don't care, right? It's like they're bringing on an optometry practice. They're also bringing on a dry cleaners. They're also bringing on a yogurt shop. But all the requirements are different for healthcare, of course. So the first thing I would tell you structurally is those 12 to 20 plus documents. If you don't have those, if you only have 3, 4, 5 documents, you need to get that done like immediately, right? Because that's like the foundation.
New hire documents.
New hire documents, and I call them new hire documents. But if you have employees that you've hired for a long time and they don't have these documents, you need to get them. You need to get these documents to them and make them sign. Okay, so that's number one. Then the second thing is, you alluded to it, is the employment manual, right? So the employment manual is one of those bear of a document, right, that nobody likes to do because it can be so dense and it can be so complicated, but it's really important because it's your first line of defense against the lawsuit, right? And the reason I say that is, a lawyer will say, how can you hold this employee accountable to this rule if you don't have it written down somewhere?
Right.
And if you think about it, it makes sense, right? Like, you're a parent, I'm a parent. How can you tell your kids, how can you ground your kids for something if you haven't told them?
Sure.
Right.
What they did wrong. Yeah. Right.
Yeah.
What's the
it's
rule?
not fair. Right. Exactly. And so it's kind of the same idea. We want it all written down, and, and so we've simplified that process so that it's very, very easy for someone to get a customized manual for their office without having to go through that pain that you would normally go through, because we know it's such a bear to overcome sometimes. You know what I mean?
Yeah.
So that's the second thing. And then the final thing structurally is the termination documents. Okay. Now, nobody ever likes to terminate another employee. I don't like it. You don't like it. I'm sure none of us do, right? And we don't like it when employees leave either, but that's part of human nature, right? Like, people come and go. But these termination documents, everyone needs to have these for both people who resign and also people who are terminated, because it documents the reasons, it documents the final paycheck, it documents all these important things, Eric, that comes back and bites you in the rear later.
Right.
The employee says, hey, I didn't get this, I didn't get that. So
yeah. And Well, before sharing some other things some other questions I have building off of that, to kind of recap, once again, HR, it's a big world. It's a big world, but think structurally, okay, for every employee, you've got all of those employment documents on hand.
Yeah.
And be sure, I mean, Ali, you mentioned that depending on which state you're in, this may range anywhere from a dozen to nearly 30 documents,
Almost.
depending on which
Yeah.
state you're in.
Yeah,
So,
exactly.
so absolutely ensure all those employment documents are on hand and up to date. Number two, that employee handbook, and you said it best, Ali. This is going to be the first line of defense for any sort of employment violations or accusations that would perhaps come flying. And it is unfortunate that we do live in a time where at
Yeah.
times there are some heinous accusations that are being tossed about. And the degree
Terrible.
to which an updated employee handbook that's compliant not only federally but also state specific is going to be absolutely huge in mitigating that. And then the third piece is termination documents, and whether that's by way of termination or resignation, be
Right.
sure that that employee is fully turned out and processed, because suppose then that also then opens this can regarding unemployment claims and all of these things. So once again, to our listeners out there, it's vitally important that you're proactive in this stuff. And I think that, Ali, leads to now to kind of shift gears into where doctors can start and the solutions that HR for Health brings to the table. Because I think that sometimes doctors are hesitant because they're trying to do everything on their own, right? Like, you're in clinic all day, then you have, if you're a parent, you have after school activities with the kids, then dinner.
Right.
Then after the kids go down, you're trying to hop on Google and try to figure out my HR for my business.
Yeah.
But why don't we talk about, for listeners out there that are on the path, and whether they're starting a practice, whether they're establishing their practice, or whatever's on the horizon, where can they start in getting their HR house in order? And what are some of these tools and solutions that HR for Health brings to the table?
Yeah, no, it's a great question. So I think it depends on where you are in your career. Okay. If you are one of the blessed people who is just starting their entrepreneurial journey, right? And you're working for someone and you're like, I want to open my office, or I want to do, so I want to do a cold start, or I want to buy someone's office. Okay. You've got it the best, right? Because you can do things right from day one, right? From day one, you can set your HR setup correctly. You can get your manual correct. You can do it all correct, and then it's on overdrive, right? And you don't have to ever worry about it again, because as employees come and go, you've got HR for Health, you've got them on the system. It's just you're managing it. You don't ever have that stress. So depending, if you're early in your career, just do yourself and your family a huge favor and just get on HR for Health from day one and make sure your office is compliant moving forward. And I guarantee you, your risk of getting into HR lawsuits will fall dramatically, and your stress level will fall dramatically. So for them, I think it's much easier. If you're in practice, right? You're in practice, and you've been doing things kind of correctly, kind of not, right? We all have those things in our back of our minds that we're like, I need to do more of that, or I just know I'm not.
I got to get to that.
Right. Yeah. It's like I know I'm not doing it correct, but I don't have the time. So for you guys, I get that. It is one of the hardest things to overcome, is to power through that feeling of, hey, if it hasn't happened yet, maybe it won't happen, right? But I can tell you just from experience that it will happen once in your career, most likely, because things are happening. I mean, just this morning, right? Just this morning, I was talking to a doctor, and she has 3 employees. One has been with her for 28 years. The other 2 were 2 years, and another one was 9 months. And they have sort of ganged up because of the one that has been there for a long time, the 20-some-year-old. and have basically are demanding all these things from her now that she's
Oh,
not doing
goodness.
correct, right? That she's not doing correct. And they even said, hey, we've gone to the labor board already. So, if you can fix stuff now, maybe the penalties will be less. So this is someone that, was with her for 20 some years. She practiced for almost 40, or she's practicing almost going on 40 years. But this employee has been with her for more than half of the time, and she still brought this up. I mean, can you imagine the pain, right? The hurt.
Sure.
And
Absolutely.
and now she's like gotten a couple of other employees together. So like the cost is going to go up. So my point is, just if you can fix the ship first before you get a letter or before the employees get mad or whatnot, you can fix a lot of things and be okay, because there's a secret way of becoming HR compliant and not having legal liability for all the years that you've done things wrong in the past. But you got to do it sooner than when you
Sure.
get a letter. Does that make sense? So
Yeah. Yeah. Absolutely. Fascinating stuff here, Ali. Really, it's truly, considering all the dynamic changes going on in the workplace right now, and new employment guidelines. I mean, constantly changing at the state level, and now again, post COVID era, now we have more of a federal lean into some of these employment guidelines. So I think it's never been more important for doctors, for business owners in any line, but especially in healthcare, for doctors to ensure HR compliance. So, look, to kind of pull it all together, why don't you share a little bit about what you guys provide at HR for Health, and how folks
sure.
can connect with you and learn more?
Yeah, sure. Yeah. I mean, we've talked a little bit about it already, but basically, what I did as a lawyer about 10 years ago now is I saw that a lot of our optometrists were being sued for all these HR violations, not again based on doing things intentionally wrong, but rather just not having the resources to be able to do things correctly from day one, right? And so we created HR for Health to allow you to, in essence, be HR compliant on our online platform, whereby employees clock in and clock out. Their benefits are tracked based on their clock in and clock out. They have all the new hire documents we talked about. You can do performance reviews. You can do violation tracking. We've got this cool thing called a scheduler that we just launched, where you can schedule your employees and visually see sort of where they are. And if there's a gap, like someone calls out sick and whatnot, being able to fill that gap quickly. And then of course we've got the termination documents as well. So our goal is to hold the doctor's hands from the very beginning, from the hiring process all the way through termination. And to support them, we give them a free employment manual every year that's customized to them. It doesn't mean they have to do it, Eric, themselves. We save all their info, and then when new laws change, we just update the manual, and then the employees get it and they must sign it. So that's a huge thing. And then the second thing, we have an entire HR team that is available to talk to them with questions, because no one's going to become an HR expert listening to you and I talk. But what is important is that they start hearing this content, and when they get in trouble, they can raise their hand and ask for help, right? Because that's the key, right? Is come to you, come to me and saying, hey, I know something's wrong, I need help, as opposed to not doing anything and then getting in trouble deeper, right? So
Absolutely. It's all about being proactive, Ali,
yep.
right? I mean, whether we're talking about HR and legal or other aspects of the business, it's about doctors being proactive in their business. I liken it to patient care, right?
That's
Be
right.
proactive with your business the same way you're proactive with patients.
Right.
So in order to do so, it starts with analysis, understanding the landscape of what's going on, then putting together that strategy based on what? Based on the data. And I think when applied to the world of HR and legal, I mean, the data is what? Hey, there's more exposure now than ever.
Right.
So I don't even know if there would be time in the day, even if someone was constantly Googling this stuff all the time, to be aware of what's going on. So really fascinating stuff that you guys have put together. And Ali, and for our viewers out there, Akrinos and HR for Health work very closely, actually strategic partners with HR for Health, powering all of Akrinos's HR offerings. So on that note, I'll actually invite you to head on over to Akrinos.com where you can learn more about how HR for Health and Akrinos work together to power your practice. Ali, before we go, how can folks get in touch with you? I know you frequent LinkedIn. Folks can connect with you on LinkedIn.
Yeah, thank you. Yeah. LinkedIn is a great place. My email is probably the easiest way. If anybody wants to do it, it's just basically my initials. So AO at either hrforhealth.com or AO at dmcounsel.com. And it sounds like Eric might be putting it on the screen for everyone. So yeah, either way works. I'm or you can just Google me. I'm everywhere, and so you can kind of find me that way and come to our website. But yeah, don't hesitate to reach out if you have any questions about any of this. I know we've talked about a lot of different things, some super complex, but it's doable, it's manageable. So
yeah, absolutely. Well,
awesome.
Ali Oromchian, HR for Health. What a great, insightful conversation all around HR and the modern practice. And Ali, also, I want to thank you all on behalf of Akrinos and all of our attendees registered for Business Builder. Thank you all so much for HR for Health and DM Counsel being founding sponsors of Business Builder. So for our viewers out there, if you want to learn more about how you can protect your practice and actually connect with Ali live, we'll be having a workshop around this live at Business Builder. Head over to Akrinos.com and register for your seat. So, Ali, thank you so much for joining us.
Thanks, Eric.
Akrinos Access.
It's going to be a lot of fun. It's going to be a lot of fun seeing everyone at Vision Expo East at your event. And thank you for inviting me to speak today.
Absolutely.
Yeah.
Have a good one.
Bye, everyone.